Namaste. Welcome to the Healthy Joint Club videos. We all know that there is a big relationship between our diet and our well-being. A little change in our lifestyle and food habits can improve our health a lot. Diet also plays an important role in the well-being of our joints. In the following talk, I will explain the relationship between joint pains and diet. I will also try to clear some misconceptions we have about our diet. So, what is the relationship between the diet and our joint pains? If we take food in excess of our needs on a regular basis, we tend to put on weight. This excess weight falls on the lower spine, hip joints, knee joints and the feet, leading to aches and pains in all of these joints. The joints also tend to wear out due to this excess weight. This is the direct physical relation between our food and joint pains. We tend to hire porters in the railway station to carry our heavy bags, but we do not realize that we carry our excess body weight all the time. In addition to this physical relation, there is also a chemical relation which is an indirect relation. Obesity means excess fat in the body. The chemicals from the fat may make our joints even more painful by aggravating inflammation. Many people wonder why they are getting joint pains when there is no history of joint pains in their family. Their mother or grandmother may never have had any joint pains. All over the world, the joint pains are getting more common. You can see that in 1985, about 15% of population was suffering from arthritis, whereas in 2002, it is about 20% of the population. So, why arthritis is on the rise? I will try to explain in my next slide. Among other factors, diet is an important cause for this rise of arthritis cases. When we analyze the number of arthritis cases, they are definitely more among patients with high body mass index, that is in patients who are overweight or obese. The occurrence of arthritis is about 25% in people with heavy weight, which becomes higher as the body weight increases. So, how do you know that you are of correct weight or in excess? We take certain measurements to calculate the body fat and the risk factors. We use BMI, that is body mass index, waist circumference, waist and hip ratio measurements to see if the patient is heavy. Each one of them give different information and together we get a good idea of the overall risk for health and developing arthritis. We cannot tell that somebody is very heavy just by checking his or her weight. Weight can vary depending on your height. A 70 kilo weight may be excess for a person of 5 feet height and may be underweight in a person who is 6 feet tall. A body mass index is defined as the individual's body weight divided by the square of his or her height to give result in kilograms per square meter of skin surface. Body mass index is a measure of body fat based on height and weight that applies to adult men and women. This formula may not be very accurate in children, elderly and in athletes. In muscular people, BMI may be higher even though the person may be not fatty. Here the waist circumference can be useful. For example, in athletes with more muscle mass and less fat, the BMI may be greater than 25, but the waist circumference measurement would be most likely to indicate that he or she is in fact not overweight. Changes in waist circumference over a time can indicate an increase or decrease in the abdominal fat. Increased abdominal fat is associated with an increased risk of heart disease, diabetes and blood pressure. A waist circumference of more than 40 inches in men and more than 35 inches in women is considered high. Waist-hip ratio is a measurement of fat distribution in the body. Your health is not only affected by how much body fat you have, but also by where most of the fat is located in your body. Women within the 0.7 range are less susceptible to diabetes, heart problems, and ovarian cancers. Men with a waist hip ratio around 0.9 similarly have been shown to be more healthy with less chance of prostate and testicular cancers. The waist should always measure less than that of the hip. People who tend to collect fat around the abdomen, chest, and around internal organs have apple-shaped body and are linked with coronary heart disease, diabetes, stroke, and high blood pressure. They may also get gallstones. The shape is predominantly a male phenomenon, although women are prone to develop an apple shape in the midlife, particularly after menopause. There is also evidence that abdominal fat develops when you are under long-term stress. The hormone called cortisol is released during stress, and it seems that high levels of cortisol in the body tend to encourage central fat accumulation. People who tend to gain weight mostly in their hips and buttocks have roughly a pear-shaped body. Hip fat contains long-chain polyunsaturated fatty acids, which is supposed to be a safer form of fat. Fat at the hips and buttocks may not be bad chemically, but it can still add to your overall body weight physically. As long as you avoid excess weight, being an apple-shaped body or a pear-shaped body doesn't put you at special risk. And even pear-shaped people should take particular care to keep their weight within the normal limits to avoid the health problems associated with obesity.